Hi there, my name is Gaston. I'm here at Immunity Therapy Center. I'm over here with Claudia and Hendrick Tuppe, and we're just gonna have a conversation about our experience at Immunity Therapy Center. What brought you here, folks?
Cancer. Yeah.
Cancer.
Mm-hmm.
What's your diagnosis?
Well, it's a good one, a good prognosis. The diagnosis is a cancer on the back of my tongue,
Okay.
which then showed up on the outside with a blown up lymph node. Grew slowly. We started investigating it in about January. Mm-hmm. We've pursued the normal sort of directions, seeing the doctors and getting all the not medications, but all of the correct procedures and what was supposed to happen. But I didn't feel confident about it at all. So in my mind, I started to develop a plan of attack because I'm a structural sort of person. And I knew I had to, first of all, detox and then create a situation where my body would see the cancer, and then also to improve the ability of my body to beat the cancer. And that was all developing, and we were laying all this stuff out, and it just overlapped nicely with exactly what Dr. Batista's doing.
Oh, great.
So we were fully confident when we came down that this is the better way to go, rather than to go through all the normal practices of radiation and chemotherapy and the misery and everything that's involved with that. This would just be so much better.
Absolutely. And tell me, how was it affecting your daily life, mostly when you found out about your diagnosis back home?
We live in Hawaii. We've been there for many years, and Hank runs a business there. And actually, he had no symptoms whatsoever. Maybe a little bit more tired, but when you get older, that's what happens. But the main thing was the lump on his neck. And it started out real small, and in November, and by the time we got back from Christmas, it was about the size of a plum. And that's when we had it investigated. So we knew then that what we were dealing with after they did a biopsy.
Okay. How's it been? What was your expectation of this whole IT experience of coming into Mexico from Hawaii? Such a long journey.
It was nice. When we got here, we got here at night time, so we didn't see much. But when we started looking around the next day, driving from the apartments to the center, you could see there's all these buildings being renovated and cute little houses, it was really sort of different than what I expected. And then after the therapy sessions, we walk around and find these little cafes and boutiques, and it's like, wow, this is pretty cool. I like this. And everybody in those stores is just incredibly friendly.
Yeah, the people are wonderful. They're very loving, especially here at the center. I mean, everybody just does the most wonderful, loving things. And I know even yesterday there was a fellow that came in for the first day, and he said somebody came in to talk to him, and I was in the room, and they left, and he said, "Can you believe how nice these people are?" And I said, it's just a loving environment, which is so conducive to healing. But we've really enjoyed the time that we've been here so far.
That's so great to hear.
We had no idea really what to expect, except for what we knew from what we had seen 4 years ago on the documentary.
Okay.
Yeah. And when we found out about the therapy, because we knew from 4 years ago, it wasn't until we called and Gamma started talking about some things that I realized that there was over 30 different other centers. And to know that we were already zoned in on one specific center, and we know that every day that we've had a piece about what we chose.
Oh, good.
Yeah.
Good. How's it been so far with treatments? Is there any painful treatments? Has it been invasive, or
No.
what's been your experience so far?
Well, Adolfo's jokes are a little bit painful, but no, that's Alfredo.
Oh.
But no, the guy that works on me a lot. But he's a crack up. He keeps me going all day, and that's a part of it. You know, you get they're good, friendly people, so your attitude stays up. You know, and the camaraderie between all the people on the different therapy benches and things. It's not what you'd normally suspect in like a hospital or anything like that. And we've all become good friends because a lot of us live together.
Mm-hmm. In the same apartments.
And that's part of keeping everything up. You know, that Korea was saying a little while ago that the environment is one of the things he looks at for your blood, for your body. And this is it, if you can keep your endorphins flowing and stuff.
A couple left yesterday and they were here to greet us the first morning we came down to get into the van to come to the center. And they had to leave yesterday, and we were all out there washing their windows because they brought their truck. And we were packing the back end of their vehicle, and nobody wanted to leave and nobody wanted them to, and there was tears, and and everybody had their addresses, and everybody's praying for everybody else, and the folks are family, along with all of you as well.
That's so great.
Yeah.
Tell us a little bit, what do you think, how's it been with your experience with Dr. Bautista? What was your impression when you met him?
Well, he's definitely knowledgeable in the product that he has here to show people and to help people. There's really, not much I can say. He just fits the, fits the bill. Exactly.
He was the first, besides Gamma, he was the first one we talked to. And when he called after he had seen his reports of the biopsy and the PET scan, etc., that he responded in a way that we didn't even hear from our doctor back home. He knew what he was talking about, and he was very open and communicative about what needed to be done and how they would go forward with that. And so I felt at ease right away. And of course, I thought he would be our doctor, but then I realized once we got here that he oversees all of it. And of course, he helps guide and direct with the prognosis and what they're going to choose for therapies, etc. So we were just really pleased, and he sees each of us every week. So we have the opportunity to spend time with him and ask him all the questions that we would like to ask.
Henry and Claudia, well, if there's anything, any message that you can tell for people seeking for help and are maybe hesitant or afraid of coming into Mexico, Tijuana, Mexico, to going the alternative medicine route, what would be that message? What would you tell them?
Well, I think primarily is that our bodies were created by God, and they have the ability to beat anything that comes out if we give them that opportunity. We get messed up over the years with different foods that we eat, and all the things that they put out there for us to live on.
Yeah.
All in steroids and stuff that add to the problems. But our bodies can still beat that. So that's the primary thing is we have that ability. Where we found, or I find it to be very peaceful for me, is that I came here first. That means when I found out what I had going on, this was my first choice. Many people who come here, this is their last choice, and they still walk away in a lot better condition than they were when they got here with a better prognosis.
And wishing that they would have started. And I think that's the key is giving your body a chance, because what you do here enhances that. It strengthens that, and you start out that way for a good week before some of the other treatments, and even I don't want to say harder treatments, but more effective, or what do I want to say, with a little bit of chemo or a little bit of the stem cell and those kinds of things. Those treatments are also just amazingly healthy, and it's allowing your own body to work. And I know that by watching Hank and the other patients, they're all different. They all have to go through something different, but there's always a positive outcome. There's always a good thing. So I would just recommend anybody to not even think about it and just to trust and do the right thing. And then they've always got that other alternative if that's what they want for themselves.
Yeah. And if you look at the consequences of somebody going through surgery and chemo and then radiation, at the end of that time, their body is spent. It's been pounded, and now they have to live on. With what? They've got 3 wheels off their car is broken. You know, they can't do anything. But when I leave here, I'll leave here with a body that's been built up to defend myself from any future attacks. So, I mean, there's no comparison. It just doesn't add up.
Well, that's great. Well, I thank you so much from the bottom of my heart for having this conversation with us. We're asking people to follow us if they're interested in cancer care, alternative medicine. We're asking you to subscribe, follow us, because we're going to be posting more videos more often, and having people like you genuinely honest goes a long way. So I thank you from the bottom of my heart.
Thank you.
Thank you for having us.
For everything.
Yeah, thanks for looking after us.
Thank you very much.